For Global Medical News Network, I'm Heidi Spleet, reporting from the annual European Congress of Rheumatology in Rome, Italy. Clinically relevant cutoff values for disease activity and patient improvement have been established for the new Ankylosing Spondylitis Disease Activity Score. The ASDAS is a composite score designed to be more effective than previous assessment tools, according to Pedro Machado.
Basically, the score was developed in analogy to the DAS for rheumatoid arthritis. And we used a similar methodology, which involves principal component analysis and factor analysis, in order to determine which variables are redundant and which ones are not, and then find the composite score that best represents disease activity itself.
What are some of the problems with evaluating ankylosing spondylitis?
Well, I guess that relates to the concept of disease domains, and in ankylosing spondylitis you can have several domains. You can have clinical disease activity itself, you can have function, you can have data on mobility, you can have data on quality of life, you can have data on structural damage itself, and it is important to separate things and to correctly assess each individual domain independently. And moreover, you can have individual measures like patient global, physician global, pain, fatigue, duration of morning stiffness, well, a whole set of individual measures. And what happens is that commonly all of these measures can be used for disease activity. And in fact, they are quite redundant, and in order to capture the whole concept of disease activity, you should pick up those that add value to each other. So get rid of the redundant measures and find probably a composite score that, by unifying those little bit of pieces that add to each other, make a more valuable index for disease activity.
Is this score feasible for use in clinical practice?
Well, I think it is feasible, and it just involves 5 simple questions. It's even easier than the DAS, where you have to make a joint count, a tendon joint count, a swollen joint count. Here you just have to make 3 questions that you already used to do, which are the one question about back pain, which is similar to the second question in ASDAS, a question about the duration of morning stiffness, which is similar to the 6th question in ASDAS, and a question about peripheral pain and swelling, which is similar to question 3 in ASDAS. Then you have patient global and an acute phase reactant, either CRP or ESR. So simple questions, and once you have a simple way of calculating, like you have for the DAS score with automatic calculators, I think it is very, very feasible in clinical practice, yes.
For Global Medical News Network, I'm Heidi Spleet.